be telling you about seizures in children. And the reason why this topic has come up to me is, I'm going to start with a story. On February 15th, my son's school called me. I was at work, it was a Friday, and said, "We found your son passed out in the bathroom." So of course, like any normal parent, I'm freaking out, driving to the school, find out what is going on, and I get there, and he's totally conscious and awake, and has no idea who I am. I sit down next to him, he doesn't recognize me, he doesn't know anything that's going on. So, anyway, a trip to the emergency room to see what's going on, and this is kind of what I've learned, and how we're getting to what a diagnosis may be or may not be. I'm going to pretty much read this verbatim because this is a great definition and I could not remember all of this. So, seizures. It says a child's brain contains millions of nerve cells. They communicate with each other through tiny electrical charges that fire on and off in a random fashion. When some or all of these cells suddenly begin to fire together, a wave of electrical energy sweeps through the brain, causing a seizure. And that's exactly what it is. I have some pictures up here I'll show you of actually people having seizures and what they look like. And for a lot of the time, they don't even know what causes seizures. There's multiple things. And not because, just because you have seizures doesn't mean that you have epilepsy. So they kind of go hand in hand, and I'll kind of talk about both of those as well. Here's a couple statistics. Sorry, they're kind of small if you can't read them. It says more than 3 million people in the U.S. have some form of epilepsy. So some kind of seizure disorder in general. And there's many types, which I'll talk about as well. 300,000 children under the age of 14 have epilepsy. 200,000 people a year are diagnosed with new cases of seizure disorder in every year. And 7 out of 10 cases diagnosed have no known cause. And that makes it a little more scary and a little harder to treat. This right here is just kind of a little pie graph. It says that 70% of those, this is the 7 out of 10 again, are idiopathic, which means that it has no known cause. The 30% is remote symptomatic. They know something that's wrong in your brain, and they can pinpoint it and they can treat it to tell you what's wrong. And there are many causes to the seizures. They can be symptoms of underlying problems, brain tumors, those kind of things, scarring on the brain. Most childhood seizures are idiopathic, as I had said. There's no definite cause. They can be outgrown, especially if they happen in smaller children. By their teenagers, they usually outgrow those. And they will cause no other problems in the brain. You won't have any kind of any future problems, like it doesn't weigh heavy on like Alzheimer's or any of those kind of things. So once it's there and it's done and it's gone, they don't know what happens to it, but it doesn't come back to affect you in the future. There are a couple different types of seizures. I'm going to kind of break it down for you. There's quite a few. I'll try to do it in layman's terms, the way that I've been learning it. So seizures are classified in 2 different ways. The first one is generalized seizures. And this is an electrical disturbance in the whole brain. So this is where your whole brain is misfiring, and that's where these are coming from. There's a couple different types. The convulsion seizures, tonic-clonic, or grand mal. And I think when everybody thinks of seizures, this is what they think of. The person flopping on the floor kind of a thing. Stiffening of the body, not being able to breathe, they turn blue, biting of the tongue, those kind of things. Loss of consciousness, definitely. A lot of people obtain head wounds because when they do have a seizure, they don't know what's going to happen. They fall down and most of them hit their head. And also most of them have loss of bowel or bladder control, which I think would be kind of embarrassing if you had one of those, definitely out in public. This is what they're looking at on my little boy, absent seizures or petit mal. You can lose consciousness. He's been kind of doing that in and out. But also eye fluttering, blinking, or a blank stare. And a lot of people can confuse this just with inattention. They can have up to 10 to 20 a day. And sometimes, like if you're just talking to them, they'll just totally be gone, realize where they're at, and come right back. You have no idea what causes it and what they're thinking. My little boy says that when I'm talking to him, he can still hear me, but he can't answer me. So he's just sitting there inside of his body, but he still knows where can still hear me. He doesn't know where he's at, and when he wakes up, he looks around, sees where he's at, and usually calms back down. There's another one, it's called partial seizures, and this is only when one part of the brain is affected. So this is if you had a tumor or scar tissue or anything in your brain, this is where this would come in. So simple, partial, or focal, and this usually happens to one side of your body, so if you have an injury on your brain on one side, it usually affects that side, and vice versa. Numbness or limpness, and consciousness is usually not affected. So some people, the studies that I have read and the people that tell their stories, like their face will go numb, they can't see out of one eye, they can't smile, those kind of things, can't hear out of one ear. This other one over here is complex partial or psychomotor. Changes in consciousness or a trance-like state. They sit there, but they still continue to do what they were doing, and they don't know that they're doing it. They have uncontrolled motor skills. So, I mean, if they were sitting there cooking or driving, they can still, their body will still continue to do that, even though there's nobody home. They're not at the wheel, literally. So that's what it says, series of automatic movements followed by confusion, because when they come to, they have no idea what had happened, but they actually don't pass out. So this brings us into epilepsy. Like I said, you can have a seizure disorder, and it doesn't necessarily mean that you have epilepsy. But epilepsy is a chronic neurological disorder characterized by recurrent seizures. If they look into your brain, there's multiple tests that they can do, and they can tell you what epilepsy is and what kind that you have and how they can treat it. They say that if you have 2 or more seizures, that you can be diagnosed with epilepsy after they do their testing. There are many causes of epilepsy: head injuries, sports, especially when your children are small and they fall down. It can take years for that to come back. Just when your child is growing, every child has a soft spot, and when their brain forms together, sometimes that has scar tissue even though there was no injury, and that can cause seizures as well. Usually that one's required with surgery. If they take the scar tissue out, usually the child is back to normal. Brain tumors, genetic conditions, something that you were born with, something that was genetically wrong with you from the beginning, any kind of lead poisoning, problems in the development of the brain before birth, so if there was any complications with pregnancy. Infections, meningitis is a big one. They always tell you to watch your children for that. And anything with family history, any blood-related relative, a first line of parents, siblings, that increases your chances to have seizures if they have those as well. A couple kind of tests that they do. I've been in for all of these. It's very interesting to see and very, very expensive. I hit my deductible in one day. So, an EEG. This is an apparatus where they stick electrodes to your brain. They sleep deprive you. I had to stay with my son for 24 hours continually and take him in, and they monitor when you sleep, because that's when most of your seizures occur, is when you're sleeping. So we took him in, and he slept through that. And I have a picture that you'll be able to see here in just a moment, and an MRI, and that's that big tubular machine that they stick you in and take pictures of your brain. It's a 3D thing so that they can kind of cut it apart and look at it and see what's inside. Other tests that they can do on you, they're getting better with blood and urine tests. They can actually tell if you've had seizures by some of the chemicals that are left in your body that are secreted in your brain in CAT scans. This is an EEG of a normal brain wave. This is what it should look like when you're sleeping. This is what it looks like when you're having a seizure. It's just off the charts. And this is an absent seizure. This is what my little boy was looking at. Here's a picture of an MRI. That's kind of dark. I apologize. This side right here is just the normal tissue of the brain. This side over here actually has some kind of damage in it. And that's where it segregates what kind of seizure you have, and this would happen on one side of the body, a partial seizure. So to sum it all up, and so what does this all mean to us is that many parents are unaware that their children are even having seizures. As long as I think back, my little boy's had them since he's been walking around, and it took him to pass out for me to realize that that maybe is what it was. Many children who have seizures show no symptoms or even evidence that they even had one. They don't relate and don't have any idea as to what it is, so they usually don't tell you about it. There are many different variations in epilepsy and the types of seizures produced by the brain. As we saw, I kind of broke down just in layman's terms for you. There are lots of variations in epilepsy. We would have been here for 2 hours if I would have told you about those. And only the testing that I told you about, the MRI, the EEG, can tell you and make an accurate diagnosis if you have epilepsy. So, any questions? hold on, cruise right through that. Am I under 10 minutes?
No, you're right on.
I
You're
am?
great.
Do you know what kind of seizures your son's having?
He's having those absent seizures. Usually those don't make you lose consciousness, but he started to. So we've made several trips to Primary Children's Hospital in the last couple of weeks. And we're just waiting to hear back.
Is there like
You know what, I haven't studied, actually, they gave us